I'm Adrian, and I'm gonna perform an anterior drawer test, which is testing, a positive test would be laxity of the ACL. So how we're gonna do this, we're gonna put some weight on our foot, come behind her calf, and for testing of the ACL, you're gonna pull forward, and then it's a bilateral test, so we would do it on this one as well. And a positive test would be laxity. The posterior drawer test tests for laxity of the PCL, and instead of pulling forward, you're gonna push the force back towards her. And this one's also bilateral, so. And then positive test would be laxity. Next test is the anterior Lockman's test. And this also, a positive test would be laxity of the ACL. So for the ACL, you're gonna put your hand on top of the femur, one hand underneath her calf, below her knee, and you're gonna push down on this hand and up on this hand. So like that. This is bilaterally. Like that. And then for the posterior Lockman's test, you're gonna switch your hands. So one hand is under femur, one hand's actually, no, that's right. Okay. And then you'll push up with this hand and down with this hand, like that. And then do it bilaterally. And that's laxity of the PCL. Next test is the lever sign test. So make sure her heel is on the table, and then you put a fist down here. And then, this positive test would be if her heel does not move up off of the table. So this is testing the ACL.
I'm Sarah, and the first test I'm going to be doing is the valgus stress test. So for this test, you want to lift up your leg and do a lateral force on your knee. And a positive test would be laxity, so you're going to have to test it bilaterally. And a positive test would indicate an MCL injury. So in addition to doing it at full extension, you have to do it at 20 degrees. And then you come over here, do it bilaterally. And then the next test is the varus stress test. And so for this one, you're going to put a medial force on the knee. And this one is also testing laxity, and a positive test would indicate an MCL injury. So you want to do that one also at full extension and at 20 degrees. And then bilaterally. And then the next one is the Apley's compression test. So for this one, they have you laying on their stomach. And then you are going to put a little axial force right here, and then and then externally rotate their ankle. And a positive test is pain, and that would indicate a meniscus injury. And then the next one is the McMurray's test. Oh yeah. Sorry. So this one, you want to put your thumb on the medial joint line and your middle finger on the lateral joint line. And then you're going to move the leg through a full range of motion. And a positive test would be a painful click, and that would indicate a meniscus injury. And then the last one is the Thessaly test. So this one, you are going to stand on one leg, and then you're going to do like a mini squat and then rotate. Nice. And then pain with that would be a positive test, and that would indicate a meniscus injury.
Hi, I'm Brittany DeGraff, and for my first test, I'm going to be doing the hamstring 90-90 test. So to do this test, you're going to ask your patient or athlete to bring their knees up about 90 degrees, and then they're going to take one knee and fully extend it as much as they can. If it is 20 degrees from full extension, that is a positive test for tight hamstrings. And I'll have you sit up. Alright, so the next one I'm going to do is the patellar grind test. This is going to test patellar femoral syndrome or chondromalacia. So first I'm going to ask you to tighten your quads before I touch her. And then if that is painful, you don't need to go further. But if it is not painful, you can go ahead above the superior pole and apply some pressure there. And then ask them to tighten their quads again. And if that is painful, that is a positive test. The next one is a sweep test. So what you're looking for is joint effusion. You're going to move that fluid around if there is any in there. You're going to test it out. And if there's a bulge or a bubble or anything, that is a positive test. The next one is the Noble's compression test. This is testing the iliotibial band for iliotibial band syndrome. So what you're going to do is you're going to want to apply pressure around that iliotibial band a little bit above their knee on the lateral side. And you're going to have them bend their knee. And you're going to go throughout the full range of motion. And if that is painful, that is a positive test. And I think the last one is patellar apprehension test. So what you're going to want to do if you suspect a subluxed patella, that is what this test is for, you're going to want to try this test. And so you're going to let your athlete know that you're going to touch their patella and move it medially or move it medial to lateral. And if they're apprehensive or they don't want you to do it or they look afraid, you can go ahead and say that that is a positive test.